and welcome to Medical Dialogues. I am Dr. Bhumika. Let's look at today's top medical news. Study highlights mental well-being fuels physical fitness. According to a recent study, the tendency to experience positive affectivity contributed to people being physically active or even increasing their activity during the COVID-19 restrictions. In contrast, depressive feelings were linked to lower physical activity. The results suggest that mental well-being can help maintain a physically active lifestyle. Mental well-being and physical activity may thus form a positive cycle. The findings are published in BMC Public Health. In the study, it was found that most men and women aged 60 to 88 either maintained or even increased their level of physical activity during the restrictions imposed by the COVID-19 pandemic. Participants who experienced more positive affectivity had higher physical activity levels and were more likely to increase their activity during the restrictions. Study links ADHD diagnosis to reduced life expectancy in adults. Adults who have been diagnosed with attention deficit hyperactivity disorder (ADHD) may be living shorter lives than they should, finds study led by UCL researchers. The research published in the British Journal of Psychiatry analyzed anonymized primary care data from 30,029 adults across the UK with diagnosed ADHD. They then compared this group with 3,390 participants without ADHD who were matched by age, sex and primary care practice. The researchers found an apparent reduction in life expectancy for men with diagnosed ADHD of between 4.5 and 9 years and between 6.5 and 11 years for women. The study also found that fewer than 1 in 9 adults with ADHD had been diagnosed, meaning that only a fraction of the total population of adults with ADHD could be studied. However, they noted that because ADHD often goes undiagnosed, especially in adults, the new research may overestimate the reduction in life expectancy experienced by people with ADHD on average. Healthy habits take time. Systematic review debunks 21-day habit myth. In a new systematic review, UniSA researchers found that new habits can begin forming within about 2 months but can take up to 335 days to establish. The findings are published in journal Healthcare. It's an important finding that could inform health interventions to promote healthy behavior and prevent chronic disease. The study of more than 2,600 participants also found that certain factors can influence successful habit formation. Adopting healthy habits is essential for long-term well-being, but forming these habits and breaking unhealthy ones can be challenging. University of South Australia researcher Dr. Ben Singh says, potential of genomic testing to tailor prostate cancer therapy, study finds. A new review led by researchers at Moffitt Cancer Center assessed how 3 genomic tests, Decipher, Oncotype DX Genomic Prostate Score and Prolaris, can help doctors make better decisions about how to treat patients with early-stage prostate cancer. The review, published in the Annals of Internal Medicine, shows that these tests can provide more detailed information about the cancer, but experts say more data is needed on the cost-effectiveness and clinical utility of these tests, as well as their impact on racial and ethnic groups. Genomic tests look at the genes of the cancer cell, which can give doctors a better idea of how aggressive the cancer might be. For example, observational studies with low bias showed most patients with very low or low baseline risk retained their risk category, though reclassification rates varied by test. 88.1% to 100% for GPS, 82.9% to 87.2% for Decipher and 76.9% for Prolaris. A randomized trial, however, reported higher reclassification rates to elevated risk categories. Thank you for watching Medical Dialogue. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.